Hello and welcome to the year 2024. This is our first episode of season 5 of Future of XYZ. It's a super exciting time to introduce a new topic, one that many of us are thinking about in the beginning of the year. And so we are opening season 5 with a topic called The Future of Wellness. Our guest today is Urvashi Bhatnagar, and Urvashi is both an MBA from Yale as well as the physical therapy undergrad from BU up in Boston. She's a population healthcare and sustainability expert who recently released a book called The Sustainability Scorecard, which we'll get to talk about a little bit. But we're going to be talking about wellness in its unique and ways that maybe we're not all thinking about it. So, Urvashi, thank you so much for joining us on Future of XYZ today.
Thank you. I'm thrilled to be here.
Well, I want to kind of get into it because I'm thinking as we start the new year, everyone's talking about like health and wellness and meditation and exercise and nutrition and, dry January and all of like the things that we traditionally think about wellness being. And I think your, international and professional experience really broadens the idea of wellness. And I want to give you a chance to obviously define what are you talking about vis-a-vis this conversation in terms of the future of wellness?
Yeah, thank you. So I think of wellness really broadly, and I think of wellness in a very circular manner. It is planetary wellness. We are all interconnected, not only just to each other, but also economically. And I think what people don't realize is that their health and wellness is more tied to factors outside themselves and outside of their control. And sort of tied to economic activities and the general well-being of their local area, then their one-time visits with the doctor and that kind of thing. So when I think of wellness, I think of cosmetics companies being healthcare companies, and I think of their R&D departments being instrumental in taking decisions on behalf of us in a way, because we're inheriting chemicals and we're inheriting outputs of these decisions based on the products they create. So we have to be really well informed, not only about the environment we live in, but also what we're putting in our bodies, on our bodies, and our local area.
Well, it's interesting when we think about, wellness in this regard. You mentioned planetary wellness or planetary health, and we both have these virtual backgrounds that allude to this kind of green and healthy environment. But this isn't the way that most of the planet is moving today. When we think about, beauty companies, for an example, and the skin being the largest of our organs, and what we're absorbing through it. And, I want to get to a topic that is near and dear to both of us, which is forever chemicals, which I don't know if many of our listeners are going to be aware of. But I think what's interesting about what you just said is it's individual, of course, and it's our choices, but also how our wellness, our health is. But it's also community level, it's financial systems level, and then it's just kind of the ecosystem of the planet and nature and the well-being of everything. I mean, your focus, however, has been international, and it has been healthcare for most of your career at this point. What, from an international perspective, when you think about kind of what it takes, and what's happening towards wellness, what does it take and what's happening?
I think what's happening is I see a really big push, and I'm speaking very broadly, of course, but I think that there's only one way to meaningfully extend life on Earth, and that's not to just decarbonize the planet. And so it's going to take a lot more than that, and people don't realize that. It's not about being net neutral. It's not even about being net negative. It's about detoxifying our environment. So people talk about when Blue Origin and all these flights, right? When they go up, they look at Earth and they realize what an incredible planet it is in this darkness, and how I think Jeff Bezos said that even if you're not an environmentalist, it'll turn you into one. So I think it's really important to realize that our health and wellness is a byproduct of all of these systems working well with each other. And so what we're seeing internationally in terms of health and wellness is that we are seeing a big push. There's a great amount of consumer wellness that is becoming a focus for firms in general, not just CPG, all kinds of firms. We're seeing a push towards more of a holistic perspective towards health. And I use health almost as a technical term because I'm thinking of health the way we traditionally think about it, which is like payer and provider organizations. And people are saying, no, there are various other therapies that can support my overall wellness. And I expect my makeup to be not just cruelty-free and that kind of stuff, but the voice of consumer has never been louder on reproductive toxicity and other kinds of toxicity that we inherit from our lived environment, and vocal voices on e-waste. And so I see a big push towards not just ESG, but a lot of awareness as to the inputs and the questions coming back to firms saying, how are you going to take accountability for my individual wellness?
It's interesting because I think that the consumer voice is very loud, especially in the Western world. I think also for those of us that are in consulting and consumer packaged goods and type companies, I wonder, however, if it's real in the global scheme where, you know, the majority of people on this planet live on less than $1 a day, and you know, like consumer voice is they're surviving rather than thriving. I mean, you've obviously spent time in developing markets, but also, I mean, it's not even developing markets. I mean, in the end of 2023 in season 4 of Future of XYZ, I mean, we talked about public health equity with, you know, Hip Hop Health. We talked about caregiving as our last episode, you know, with the chief medical officer as well as the president and CEO of Blue Cross Blue Shield of Rhode Island. And, you know, health equity, healthcare equity is a big, huge, meaty topic, by the way, in America. So I think about the developing, quote unquote, developing world, you know, but then it's just like everywhere it's the same thing, which is like equity. So I totally appreciate that consumers have a lot of voice and we're demanding things of those companies from whom those of us with purchasing power can purchase. But equity is really important in the conversation of wellness, because when you think about the planetary wellness, like, you know, it affects all of us equally, or actually disproportionately affects those who have the least access and the smallest voices. So my long-winded intro, and that was a rant, but my long-winded intro, Urvashi, to this question is like, what are the innovations that are happening that are delivering, you know, wellness, if you will, to the communities that are most in need?
Yeah, absolutely. That's a great question. So I think I want to start off by saying, so yes, I've worked in developing markets, and I won't speak for all of Asia, but I have some experience in India, and I'm connected to some work that is happening all around Africa. And so what I've sort of realized is that individuals in these areas, they view healthcare a lot more holistically, and somehow, and perhaps this is just the echo chamber that I'm a part of, but a lot of what I hear is that there's a lot more personal accountability in these markets for their own individual wellness and their healthcare. And so they rely on their providers to provide an input, but they also have this like intimate knowledge and connection with their communities and the local history of that area. And they're aware of herbs and certain things that are available. In India, there's a big push for Ayurveda. And of course, like, it started there, but there's a big push we see in CPG markets where Ayurveda is starting to be incorporated into like mainstream products. So those are some of the indicators that I'm seeing, you know, that kind of indicate to me that there's a great deal of personal accountability because there isn't the backup of Social Security and, you know, insurance and that kind of thing in these markets.
It's interesting. So your whole background is in healthcare, really. You know, and you've experienced both the private sector that we're talking about a lot, but also the public/governmental sector. What are some of the trends that you're seeing right now as we think about the future of wellness in this kind of much broader, more holistic way?
Yeah. So as you mentioned, huge push towards health equity, and I'll speak U.S. focused first, but I'm seeing huge push towards health equity, social determinants of health. People are really starting to think about data systems and what that means. So, for example, before we would combine health records, claims with EMR inputs, and that's still, by the way, not done in a fantastic manner. It's getting there. But people are really starting to think broadly about health equity and SDOH, and the only way you can really make member fees, social determinants of health, right? And so, thank you. So the only way you can bring that information to light such that we can make informed decisions off of it and upfront preventative care to individuals, at least in the United States, is having a good picture of that individual. And that means we need to start incorporating consumer data and information about that person's environment. And so there's a lot of innovation that we see in the market, not only from digital platforms, but also solutions that address this great need. So whether you're looking at providing a solution on a slice of the pie, like racial equity or things like that, or you're thinking about a broad platform, there's a lot happening in this space that will make healthcare a lot more accessible. I mean, even things like women's health, which may be deprioritized, in my opinion, but we see a lot more products coming to market. There are firms that think about women's health broadly that are not only impacting IVF and menopause care, but also like clinical trials in that space, and how can we develop a whole solution. So I have a lot of excitement for private sector and how it's going to transform how government also reacts to this innovation and how these products are brought to consumers. And I say consumers very intentionally because we're all patients, but we're all consumers of healthcare.
Yeah. Well, and it's interesting. And I mean, there are two directions. One that you just mentioned in terms of like the private sector, your bullishness on it. I want to come to that vis-a-vis, especially the book that you just wrote, and which is called the Sustainability Scorecard, as I mentioned at the beginning. I want to come to that. But I want to talk about the money, first of all, because I know that you've been kind of involved in sell side, payer side, all these kinds of your deals, M&A. That's what you've been doing for the last little while. And your understanding of kind of like the financial side of this wellness sector is growing rapidly. I mean, I think about, maybe it's triple bottom line, so people, planet, and profits. But what is kind of the investment guidance, I mean, writ large, for channeling funds into the wellness sector today, especially if you think private sector is going to lead government?
Yeah. I think a lot of it is, I think the big signal, and there's a lot that goes into it, but I think the big signal, if I had to say one, is total cost of care. So right now we think of total cost of care almost very one-dimensional manner. And but I think the way I'm seeing the market develop, we're now thinking, okay, we don't need to just reduce the cost of life-saving medication or life-saving imaging or what have you. It's not just about access to care and delivery of care. It's about all of these various other inputs that the person has available to them, whether they want to have a child or going grow their family, they need menopausal care, whatever it is, how divorce impacts mental health, and like just all of these things. We're no longer viewing humans as a cost accounting transaction sheet. I think we're finally coming to that realization. And my
healthcare insurance doesn't make me feel that way, but that's okay. That's good.
I know. And I think that's what's so interesting is that actually, like, I realized, because I actually went from being a clinical provider to being in management and working with these organizations. And it always surprised me how few clinical providers actually make that jump. And I think a lot of the reason for why the system is the way it is because clinical providers of every type don't have a major representation in the way healthcare is run. If we did, it would look completely different.
Yes.
We wouldn't have to convince people that one certain medication has various input effects all over your body, and therefore it cannot be valued in just a single manner or what have you. Whatever the example you want to take is, at the end of the day, I think total cost of care is a metric that's being viewed in a much more holistic manner, or it's starting to be viewed that way. And I think that's a really important leading indicator.
I appreciate that. I mean, which leads nicely to your book. So the sustainability scorecard, the subtitle of which is How to Implement and Profit from Unexpected Solutions, published with BK, distributed by Penguin Random House, and you co-authored that with Dr. Paul Anastas. And it just kind of came out. And in it, my understanding as I've looked at it is it's kind of a method, if you will, for identifying where a company, a corporation is in their sustainability journey, and then giving tools for helping track progress. I mean, along this journey. And I think it's really powerful. I think it's really important. You said, ESG before, and, there's a lot of backlash these days. But I think more and more we all realize, well, I say we all, any of us who have sustainability at the forefront of our minds recognize that we need some kinds of frameworks. But what really, I mean, you've talked about your bullishness on the private sector. I mean, but what is the tie-in between corporate sustainability efforts and progress really and wellness as we've defined it in the beginning?
Yeah. So thank you. I think health and wellness, or rather like population health, public health, whatever term you want to use, it cannot be uncoupled from sustainability. It cannot be uncoupled from the economic activities that occur every day in the markets, and their unintended impact on the populations that they serve. And so it's about really viewing, it's about the E and the S and the G, but I don't want to get into the whole politics of the word and that kind of thing. Essentially, the message is, look, sustainability needs to be incorporated into your corporate strategy, because if it won't, some dinosaurs will die and others will evolve. And if you incorporate it, you will evolve, because firms that have decided that they will be relevant in the next 50 to 100 years are really paying attention to the market. They're hearing what Gen Z is saying. They're understanding that Gen Alpha is already 10% of their parents' share of wallet, is already directing all of these transactions. And they're understanding that these children are going to inherit a very, very different world. And therefore, their healthcare issues are going to be very different. Their risks for certain conditions are astronomical as compared to their parents. And so parents around the globe are worried for the future that their kids will have and their longevity, which is, by the way, one factor. As I mentioned before, it's not just enough to live longer. You need to have meaningful life in those years. And so how is that going to happen? That's going to happen by incorporating sustainability principles, not just into your life, but for corporations to think about their negative externalities and kind of reforming some of their products and processes. And so in our book, we talk about incorporating sustainability into your corporate strategy, how that happens. And we talk about it radically. We say that you need to create products and processes that are benign by design. And if you think that there has to be a trade-off, like if you think that a certain output cannot occur without a negative externality, you're just being intellectually lazy. I can't believe that we have over 85,000 chemicals existing, and brilliant chemists all over the world literally come up with new chemicals that have never previously existed on the planet. So you're telling me we're so brilliant, we can create chemicals that never previously existed, but you can't make them better?
And you can't make them disappear, right? Without harm.
Exactly. So I think that's a lot of how it speaks to a lot of how capital is invested in the world. Yes. And it's systemic. Yeah. Because
also, as you said, ESG hasn't risen up. It's become a little bit controversial, whatever. I mean, controversial is a stupid word. It's become political, right? Mm-hmm. And so, but like the investment dollars coming back to the money and the systems that are required for overall wellness, right? And the governmental indicators and governance in the ESG, not just at a private sector, private corporate level, are important. And I think that's what you're alluding to, which is, like wellness requires all of us to be working together rather than, for singular interests.
Yes, absolutely. I couldn't say that better myself. Thank you. And then, so having said that, I think another thing I want to talk about is venture. So I think venture capital, interestingly, is usually a really, really small portion of people's investment portfolio in general, unless you're a billionaire. And I'm not referencing them right now in this in this generalization, but venture is usually a really small proportion of investment. But it tends to have a really outsized impact on our life. So if you think about, like, we want to go somewhere, we use an Uber. We want to stay somewhere, we first look up what Airbnbs are really close to the restaurants we want to hit up most often in a certain city or whatever. So venture has a really outsized impact on our life. And so when you think about where venture dollars are spent, they're usually spent in really tech-driven products and solutions that are algorithm-based because they're high margin and that kind of thing, because we have resources that are trained to due diligence them really quickly. And therefore, what we forget about is supply chain heavy manufacturing and innovations in that space.
Yeah, long lead time R&D as well.
Yeah, exactly. So long development cycles, exactly. Which begs the question, do we not fund long development cycle stuff with venture? No, we do. There's a lot of investments in healthcare and biotech, and there are a lot of learnings from these sectors that we can carry over to others that can make for a more successful, and I use a more successful product and process, and I use the successful in a more holistic way. It's not just a product or a process that is completing its intended function, but it's really high performance. It's not killing you slowly over a number of years.
You're thinking
while
in
doing
terms
so.
of overall wellness. So it's wellness for the venture capitalists who invest, but it's also wellness for the consumers who consume and the planet who suffers the or in this case, doesn't suffer the downstream effects.
Exactly.
So we're at time. So I want to throw out my always last question. And I mean, as we think about, the year ahead on this, very first episode of 2024, Urvashi, what, as you think about the future of wellness, as we've described it, what is your greatest hope, and what do you see that's the major initiative in the next 10 to 20 years?
I'm really excited for people to start moving towards a more holistic wellness approach. And that involves not only just connecting all parts of the healthcare system, all the way from clinical trials to end of life and everything, and viewing a person as a whole, but also for incorporating various therapies that weren't traditionally part of mainstream healthcare, to really uphold that person's wellness, such that we're providing them minimally invasive care. We're really drastically lowering total cost of care, but we're keeping the whole person in mind, and not just unilateral inputs.
I appreciate that. Well, Urvashi Bhatnagar, thank you so much for joining us on Future of XYZ, episode 1, season 5. We've been doing this since 2020. It's kind of remarkable that we're in season 5. But I'm thrilled that you were able to join us, and everyone go out and check out that sustainability scorecard, Urvashi's book, by Penguin BK. And thank you for joining us.
Thanks so much for having me.
And so for all of you watching, make sure that you can also listen wherever you get your favorite podcast. If you're listening, you can watch us on our presenting partner, Rhode Island PBS, at ripbs.org/XYZ. Follow Future of XYZ on Instagram and leave us a 5-star review so more people can find out. Thank you again, Urvashi. Thank you, everyone, for tuning in. Happy New Year, and we'll see you in 2 weeks.